My name is Dr. Jeffrey Terrell from the University of Michigan, Department of Otolaryngology. I am a rhinologist and sinus surgeon, meaning I see a lot of patients with nose and sinus problems and help them with medical treatments as well as surgical treatments for that. I see a lot of people that need sinus surgery and a fair number of people that are coming to see me that have either had sinus surgery or contemplating sinus surgery or wonder whether sinus surgery was helpful. And I would tell you that there are many good reasons to have sinus surgery. I've outlined them in a prior YouTube video. But today I'd like to talk about the top 10 reasons not to have sinus surgery. And believe it or not, that's a fair amount of my practice, telling people that sinus surgery is not going to help them for their particular complaint or set of symptoms or issues. So what does that involve? So when the patients come in to see me, I perform a very detailed history. The history is probably one of the most important things that I do in terms of gathering information that's going to help me make a decision. Then I do a physical exam, an ear, nose, and throat exam. Sometimes we do nasal endoscopy, where we look in the nose with a small fiber optic scope. That's oftentimes helpful, but not always done. And this whole deal takes 15, 20 minutes, I would say, for the average patient, sometimes shorter, oftentimes longer. I see many patients that have 2 or 3 different types of headache syndromes going on, and trying to dissect out the different nasal complaints and headache complaints takes time. So I think that's the first lesson, is that it takes time. But after all that, there are some patients that need surgery and some that do not. I'm going to talk about 10, maybe the most common or top 10 reasons why you may not need sinus surgery and why you may want to get a second opinion, more importantly. So number 10, I would say, is you have recurring sinus infections and you have underlying allergies. So underlying allergies causes the nose to become inflamed. The little tiny openings into the sinuses will swell shut, and those people will get more frequent sinus infections. So if you have recurring sinus infections and you have allergies, where you're stuffy, sneezy, itchy, scratchy, runny, and you haven't treated the allergies, you want to do that before you do sinus surgery. If you treat the allergies with steroid nasal sprays like Flonase or some other one, and maybe antihistamines, maybe some saltwater sprays, that will prevent the majority of people from needing sinus surgery, and probably 80% fewer sinus infections. Another group of people that get frequent sinus infections are people that get lots of colds. These are elementary school teachers, preschool teachers, and parents of young kids. And sometimes just waiting that out, waiting till your kids get older, their immune system gets better, and you can avoid sinus surgery, because there are some risks to having sinus surgery. Number 9, the reason to consider not having sinus surgery or getting a second opinion is you get frequent sinus infections, or what's been called sinus infections, but maybe you got a CAT scan during the infection and there's not much abnormal on it, just a little mucosal thickening, or maybe it's a normal CT scan. So if you have a sinus infection and you get a CAT scan during a sinus infection, it ought to be very abnormal CAT scan and not minor this and slight that and slight mucosal thickening. So if you see minor mucosal thickening, slight mucosal thickening, and you had a sinus infection during that, think about it. It may not have been a sinus infection. It could have been a migraine or some other facial pain syndrome or allergies. Number 8, and this happens fairly often, is patients that have what we call mucus retention cysts. The sinuses are pretty large, and sometimes there's a round cyst that will sit in the sinus. 30 to 40% of people have a mucus retention cyst. It is an indication to not have surgery, or it is not an indication for surgery, but there are sinus surgeons that will say, well, let's get that out of there and open that up, hoping to make maybe facial pain or some symptom better. That is not advisable and not in any kind of standard guideline or recommendation for sinus surgery. Another one is if you get a report or or someone shows you a CT scan and there's minimal mucosal thickening. That's a radiologist may say that's consistent with chronic sinusitis, but it's also consistent with not having chronic sinusitis. It's consistent with a cold, with allergies, or just a variant of normal. So minimal mucosal thickening is usually something to make you wonder whether you really need sinus surgery, whether you have cold or allergies or something else going on. Certainly minimal mucosal thickening and severe headaches don't go together well. The headaches are not due to minimal mucosal thickening. Number 6 would be you have minimal changes on the CAT scan, but you have severe headaches, similar to the other one. If you have severe headaches, the CAT scan just shows slight disease, little thing here, little thing there, it's probably not a sinus infection. If you have a sinus infection causing headaches, you should be having lots of yellow-green nasal discharge. Your nose should be all plugged up. It should get better with antibiotics, probably may come back. But if you have bad headaches and just slight disease on the CT scan, that doesn't mesh and probably warrants looking for some other cause of headaches. In my clinic, the vast majority of those patients have migraines, but there are other types of headaches as well that can be chronic. Number 5, you have a normal CT scan and someone tells you you have chronic sinusitis. CT scans don't get better overnight. They don't get better in a week. If you have a chronic sinus infection, you're not going to have a normal CT scan when you have symptoms of chronic sinus infection. So if it's normal CT scan, get a second opinion, period, or read more of this online or read my blog. Number 4 is you've had prior sinus surgery for headaches and the headaches aren't better. That probably means that you did not have a sinus infection. Probably means you weren't blowing out lots of yellow-green stuff, 10, 20, 30 times the normal amount you might blow out in a day. A sinus infection should be blowing out of a bacterial sinus infection, lots of yellow-green nasal discharge. So headaches mostly are not sinus infections most of the time. If it's a severe headache, the chances are the worse the headache, the more likely it's not a sinus infection, especially if you don't have terrible nose symptoms. Number 3, your sinus surgeon, your ear, nose, and throat surgeon didn't take a thorough history. If you go in and the doctor's talking about sinus surgery, but they haven't asked you about allergies to cats or dogs or dusts or pollens, they haven't asked you about antihistamines or steroid sprays for allergies, whether you've taken them, they haven't asked you about yellow-green nasal discharge or worsening nasal obstruction, or what antibiotics you've had. If they're in a rush to recommend sinus surgery for you before trying medical treatment, before taking a good history, get a second opinion. That should follow your gut sense. If it seems odd to you, get a second opinion. Number 2, your sinus surgeon schedules you for many separate procedures. I've had patients that go in complaining of a little bit of nasal obstruction or allergies and walk out with a recommendation for septoplasty, turbinate surgery to reduce the turbinates, and open up 8 different sinuses. Sometimes those patients don't even complain of sinus infections. If your surgeon is recommending lots of different procedures for you and it seems odd, if you're not getting lots of sinus infections with yellow-green nasal discharge, then get a second opinion. That's a big red flag. And the last one is you just have a gut sense that something isn't right. The doctor was too quick. They didn't ask you questions. The doctor comes in, if they talk to you briefly, look at your CT scan and recommend sinus surgery without taking a detailed history and trying medical management first, follow your gut sense and consider getting a second opinion. There's great indications for sinus surgery. Sinus surgery helps many, many thousands of patients a year. There's about 300,000 sinus surgeries done a year, but there's a lot of sinus surgery that's done that's probably unnecessary. The surgeon may be trying to do the right thing and have great intentions to try to improve someone's symptoms. Sometimes patients really push hard to have sinus surgery, but there is a lot of unnecessary sinus surgery that's done, and I hope this video has been helpful to you to be able to think about your symptoms and think about whether or not sinus surgery is for you. Thank you.